fun just to kind of hear like a day in the life of, and
Okay.
some of your favorite uses for the machine.
But lots of questions about contractures, degenerative myelopathy, how I use my PiezoWave. Just talk at random for hours about PiezoWave because I love it so much. It feels like a massage from the inside out. That's how I describe it. Have you ever had a muscle knot that the massage therapist worked on? Or if you rolled out on a foam roller knots, those are really painful. But instead, it breaks them up without pain and relieves the tension. And then you feel flexible and released and relaxed. I said I couldn't bring my chin to my chest because my fascia was so tight. And after shockwave, I could bring my chin all the way down. You know, it just expands your range of motion like immediately. I've been using mine. I have two now because we were like having a waiting list for the shockwave at one point. And the first year I had it was probably 2017 as well. And it paid for itself and more in 1 year. So I've been using, so I was happy to get a second one so we didn't have a waiting list for it. Yeah. How do you use yours? Are you using it for tendon ligament only or for soft tissue and myofascial pain?
I'm using it for elbow arthritis, shoulder tendinopathy, biceps tendinopathies. I've got a dog coming in with laryngeal paralysis that I got a protocol from Debbie Taraka that I'm going to try here in a few weeks. It's probably
I'd love to hear about that. Yeah, I use it for all of those like ligament and joint osteoarthritis pain, but I'm also treating all the muscles around those joints. Is that your experience too? Yeah, yeah.
Yeah, it kind of depends on how much time I have, and I just have. I've got I don't have the linear probe at this point. Yeah, I mean, I use it with my knee cases that aren't going to have surgery and conservative management.
Yep, all those trigger points, right? And the proximal quads, anywhere there's trigger point, and the back there's like always twitchy muscles, and the thoracolumbar and psoas is always tight on some of those chronic arthritis dogs. So I definitely use it to treat a lot of cervical spondyle, caudal cervical spondyle, like myelopathies or wobblers dogs. Love it, shockwave. And all of my patients have back pain somewhere from compensatory postural changes, from offloading something. So I almost always treat the compensatory the muscles that are sore, not just the injured joints. So if I have like a right stifle and they're offloading to the left front, I'll treat that front leg as well. And usually time-wise, I spend about a half hour per appointment. We block off a half-hour treatment session. And in the beginning, I was the only one doing treatments. And then the other vet I worked with, she was helping do treatments. And now I've got my more senior technicians trained. They have to know the anatomy, of course, to treat an actual biceps tendon insertion, treat the biceps muscle. They have to know where that is, the focus. But once I've trained them, and then they do fan through the tissue. We don't just hold it in one place the entire treatment and just rock it like the manual that came out says, to do. I use that very sparingly, actually. I almost never really hold it in one place for that long because I have caused more pain and inflammation, and they seem a little more sore after that. I don't think it has to be an inflamed and painful kind of a treatment to see improvement, right? And I see you nodding your head, Chrissy. You want to say something about that?
Well, I find that really interesting because there does seem to be a little bit of discrepancy whether or not you're fanning and moving. And I was kind of hoping you could show me with your hand sort of how you do manipulate your probe when you are fanning.
Well, I mean, I do. I'm using the probe like a manual therapy tool. I'm moving through the tissue slowly, and I might just visualize the muscle fibers and literally just sway, go through. If I know where there's a trigger point, I can feel it, or I've got twitchy fibers when I compress them and they flinch, I'll just treat over that area, hold it there for maybe 750 pulses, just kind of rocking it around, or I'll come off of it and come back to it, go off of it, come back to it, because if the animal stops licking their treat, or they look at me like, oh, I'm feeling that. I know what that feels like when the pressure is building up from that tight spot. On the flip side, I also know when someone's fanning through my shoulder muscle treating me, if they aren't on the right spot, I feel nothing. And they get to the right spot and I say, okay, stop, hold it there. But the animal can't tell you that. So if I'm fanning through, I know I'm getting the tissue at some point that's pathologic, right? I can palpate for twitch and treat where there's twitch. I can palpate for tension. And then it's just like doing myofascial release work with your hands. If you gently compress and hold, eventually it will soften and you can get range of motion going. And I think of the shock wave as a massage from the inside out. It's compressing the tissue. It's myofascial, what do they call it? Acoustic compression therapy, MYAC. It's compressing the muscle and doing that, expanding and contracting. It's causing those knots to just relax and you can feel them dissipate. But if you hold it in one place for too long, I've created in the very, very beginning, I created a hematoma just using it in one place at about 6 to 8 intensity on a triceps in a dog that had really severe arthritis, hip dysplasia, really tight knot in her triceps. And I was working on it, and working on it, and working on it. And then she went home, and 3 hours later, they called and said she had a big baseball-sized swelling on her arm. And she came back and she couldn't use the leg at all because it was so painful. And it was definitely a hematoma. And so if you have really friable tissue in a senior dog with overuse, you can cause trauma. And I mean, that was at the 6 intensity. That's a pretty low intensity. So I've shied away from holding it in one place for that long, 1,500 to 2,000 pulses, I want to fan through. So that's about how much I'll do in one region, 1,500 to 2,000 pulses in one whole limb. Going through the pecs, the biceps, the triceps, the whole kinetic chain of that tight limb. And then I'll move on to another quadrant of the body. So I don't know if that's what you like to do, Paul. On average, my treatments, I get about 8,000 to 10,000 pulses per patient in a treatment session. 8,000 is about a half hour of treatment. Sometimes we get started right away and we're able to get a little bit more if it's like the whole dog needs treatment in multiple places. Some of those really arthritic dogs. And I charge for that time, so clients love it. They want to come back weekly sometimes for their patient. We do things in packages of 5. And so we'll say, let's treat for 5 treatments and see how they feel. And they often come back and say, she's doing great, I want to keep doing it. Or we'll try different treatments. And then they say, no, definitely it responds the most to the shock wave. And they want to substitute out some other things, laser usually for shock wave. So,
Yeah. Where are you located?
San Francisco Bay Area. I'm about 10 minutes south of San Francisco, California. Okay.
And what do you charge for your 5-pack of shockwave treatment for a half an hour a piece?
Okay, so a half-hour single session is $110.
Okay.
And for a 5-pack, we give them $20 off, I think, for a 5-pack. So yeah, that's about it. That's not a huge discount, but it's still a discount that gets them to buy the package so that we can book it, have that on the schedule, because we book out so far in advance now with all the demand for care that people get frustrated if they call up and say, I'd like to get in this week, and we're like, booked solid, we can't always get them in, or if we have cancellations, we can fit them in. But so it's better to, like, if they have a day of the week and a time that works for them, we'll say, let's book out 5 sessions. And I've had clients book out 10 or 15 and they pay for the packages, because they want to know every Thursday, I want to come at this time, or every other Thursday ad infinitum for some of these really geriatric animals or severe chronic hip dysplasia. It's just made such a difference. Now, it's not the only treatment we'll do. When they come, we usually combine some sort of modality for pain relief with some sort of exercise, whether it's water therapy or therapeutic exercise or manual therapy, myofascial, body work. Sometimes we'll combine it with acupuncture. I'm certified in acu, and so I do acupuncture, or we'll do electrical stim the back legs that are weak, and we'll do shockwave on the front end, the neck and the shoulders that are overused and painful, especially in those DM dogs. Any neuropathy, any myelopathy, IVDD dogs, they're always, the front legs are so sore and the back end so weak. And so we'll kind of do a combo, sometimes we'll start the E-stim on the back legs and then start doing some shockwave on the shoulders and neck if they can hold still for both at the same time. But, or we'll do back to back. What do you charge in Colorado?
Not enough.
Don't be afraid to charge more.
I'll leave it at that. Yeah. Cindy and I have chatted about my pricing, and I need to raise my pricing.
We just raised our prices in 2020. We were doing about $95 for a half-hour appointment, and then I checked in with some of the other rehab vets in the area, and it was typically about 110 for a half-hour treatment. So that's what we raised it to, because we're expanding our business and bought a building, trying to remodel to build a bigger space so we can see more patients, and had to increase that a little bit.
So I know this isn't really about PZOA, but I think this is something that when I go to shows, and because I represent Hero Braces as well as have my own practice, when I go to shows and I talk to clinicians in the rehab world, they're all talking about, do you charge by the modality? Do you charge by your time? So what do you do if you do let's say you just did an acupuncture session, do you charge by your time for that? Is that a 30-minute session as well? Or,
because it's specialized, because only a veterinarian here can do the acupuncture, or a licensed clinical acupuncturist under my supervision. That's takes advanced training that a technician cannot perform that treatment. So we do charge more for that type of treatment. So that our half-hour session for acupuncture, I think, is $165. But if I do a half-hour exam, it's $110. I charge for the time. And if I'm doing the shockwave versus if my technician is doing it, it's the same price, $110 for the half-hour treatment. We do have 15-minute shorter laser treatments for small dogs in particular. For doing laser, we might charge, I can't remember if it's $65 or $70 for a 15-minute session. And the same thing for my recheck. So we schedule a brief recheck appointment for people who are coming in regularly, or people who are coming in for like a 3-4 month program. I want to see them after every 5 treatments at least, if not more. But usually the techs will be booked seeing the patients that I've prescribed treatment for, and then I'll see them for a 15-minute recheck, which they pay separately for that time. So we do a little bit of both. I mean, we charge for packages for treatment modalities, and then we charge for time too. And clients usually like the packages because that way they can just prepay and they don't have to think about it each time. Especially if they have pet insurance, it's easier to submit one big bill than one every week, a small bill. They prefer to do it that way. But then we have some that don't have the ability to financially, so we do it one at a time. And they don't get that $5 discount off of the treatment session, but they're okay with that. It's just a little bit more labor intensive. So I found packages help clients commit to appointments too, because we also have, if they cancel short notice, they forfeit the appointment. So it helps us keep clients from blowing off appointments or having a last minute, oops, I forgot, I also have a haircut appointment, I can't come. Well, you forfeit your appointment unless you find someone to bring your dog in, or cancel your haircut and reschedule that.
Well, I appreciate your input on that. I think it's something, at least there's a certain group of us that struggle with. We want to take care of everyone, but get paid well enough to support our families and, buy gas. So
yeah. And I mean, I will work with people like rescue groups, or people fostering an animal for a rescue. I'll give 10-25% discount sometime. So I like to help. And then clients whose animals have passed away, often they'll donate unused treatment sessions, and we'll use that for somebody who's lower income. Most of the lower income clients that I see, we also offer them the option of applying for care credit. I don't know if you have that out in Colorado, if you're familiar with it, but they can apply for care credit and spread it out. And then I try to empower as much as I can people to go home and do treatments themselves. Like I'm teaching clients how to do electrical stim at home.
Mhm.
I'll send them home with the sissy loops. I work closely with orthopeds and orthotics, but for my orthotics patients, like with your hero patients, I would make them purchase a package of 3 follow-ups, because otherwise they just don't follow up, and then the problems go untreated and they just throw the brace in the back closet and don't use it, or
No, I
say that
agree.
braces don't work, which they do work. Orthotics do work if they're used and fitted correctly. So Piezo wave is one of the treatments they can't go home with. So Piezo wave is something that we have them, we see a lot of that here. Piezo wave and water therapy are things we can't send them home with. Laser, we actually have a class 3B laser, that respond laser, that we'll let clients rent out and take home. If it's a neuropathy and we want them to be treated every day, we'll rent it for a package price for a week or 2 weeks, a month, and they can treat daily at home. Um, but the things that they can't do, that we have to do, we have to charge for our time because cost is so high in the Bay Area.
Yeah, so well, I think it's really interesting that well, the protocols that are printed up, and the when I listen to like Matt Brunke and some of the other folks out there that are using the PiezoWave, that they're using settings much higher than I am, and I'm getting what I feel like are similar results on very low settings, like
Yep.
0.1, 0.2. I'm not even
Yep.
getting up to a half.
Yep. So in response to that, I was taught originally when I first got my unit, and there was very few small animal vets yet using it, to start at 4 to 6 and then work my way up to 8 if I could. I dropped it immediately down to like 0.2, 0.3 after that incident where I developed that one patient that had a hematoma. That was like day 4 of my ever having PiezoWave, and I was so freaked out. I thought, I'm going to return this. I'm scared of it now. And so I talked to a few other providers who were using PiezoWave then, and they said, oh no, I fan through the tissue. I don't hold it in one place. I use a lower setting. So this is something I've also cultivated. We start at a lower setting, especially if they're very painful. And when you treat yourself, you can see the difference between 6 and 0.3 if you're treating your foot. Like if you have plantar fasciitis or a sprained ankle with a lot of tendon ligament inflammation, it hurts like you stepped on an electric wire. If you put it up too high, and I turn it down to 0.3, 0.4 so I can tolerate it, and then when the pain fibers are blocked from that tapping of the sound wave, then I can try turning it up a little bit. And so I do it to effect. And the first couple visits, I start lower and we work our way up. And sometimes we don't even need to go up higher than 6 to 8. The only times I'll go above that is if I am working on muscle contracture, tendon contracture, like fibrotic myopathy cases. I have patients that have been in a splint for too long and they have no carpal range of motion, and they come to me, get them walking on their leg again. And I'm like, okay, well, they have no range of motion. So let's start with that. And we do a lot of shock wave with the carpus, tendon, ligament, and I'll turn that up 10, 15 if they're not too painful. I've had it up at 20 for my fibrotic myopathy cases. And I've felt some gracilis muscles that felt like a rope with little nodules in it become at least a rope without nodules in it. So, and then they could do some more stretching of the gracilis and get a little elongation. So they weren't tethered, their leg wasn't as tethered when they were walking. So, that's about it with the high energy. It's for the tendon and ligament things. Or if I have a non-union bone fracture that I'm trying to jumpstart create some trauma, create some inflammation. But I don't want to create more trauma and inflammation if they're already sore. I want to block the pain, relax the muscles, and then get some blood flow in there. That's pretty much the results that we get. And I don't know if you've experienced this, Paul, but if you have repeat visits, that over time you find that the tissue improves so much that you don't need to even treat certain areas. The myofascial pain, they don't keep recreating it, so to speak. Maybe it's because they're using their back legs better, so they're not shifting as much weight forward. So the posture is improved, or they're putting weight back down. But trigger points want to come back fast in certain areas, like your knee dogs, your proximal sartorius quads. That area will get trigger points back if they start overusing the leg because they feel better and the muscles aren't ready for that yet. But then over time, I've seen some of those completely resolve if the animal's young. And if the owner is doing some stretches at home to keep, warming them up and not having them with these little agility dogs running around with a knot in their proximal quads. Treating them over time, you can make it resolve in a healthy, young dog, as long as they keep stretching.
Yeah, I've had dogs, usually it's after the third treatment that even though I've warned the client, they feel so good that they overdo things and then they come in with a compensatory pattern that I have to take care of.
Yep.
Yeah.
They will always overdo things. It's a good thing to warn them about. You probably, with the hip dysplasia, right now I'm participating in a clinical trial that I've been wanting to do forever. And we got a few other clinics on board, and then pandemic made everything go sideways. And
Mhm.
the rehab departments aren't actually being used for rehab, they're being used for emergency care. And so, but I am helping to participate in this study to try to document that Wave is so wonderful for these hip dysplasia patients, not just treating the hip joint itself, which can actually make them more painful in my hands, in my experience, but treating the soft tissue, like the pectineus, the quads, the glutes, everything that attaches to your greater trochanter, basically, and your lesser trochanter. So as treat all that, and you get so much less pain,
Mhm.
and they just respond so well to that. And one thing that's interesting for back dogs, I know that a lot of people are afraid to use wave over the spine. After surgery, of course, you don't want to go right over the spinal cord after hemilam, but you have all the muscle trauma and muscle contracture from all the muscles that they had to cut through to get down to the, disc. And so I treat around that site because I've had dogs come in. They come in so kyphotic, especially if they have a surgeon who likes to fenestrate the discs above and below the injury, that they have a lot more muscle trauma. And that just treating those muscles, not even over the surgical site, helps so much relieve their pain. And if those muscles aren't spasming, then the blood flow can get into the nerves and the disc, and they have much faster return to function. Not to mention they look better and more comfortable, but they can walk better. And I had one patient come in. He was shaped like the letter C. If you look straight down at his spine, he was like hypertonic on one side and hypotonic on the other. And I treated the hypertonic side, and he straightened out. His spine was straight when he left, and it never went back to the letter C. And I was mad that I didn't take photos of before and after. I didn't think about it because I was so horrified how he presented, but it would have been a great before and after. It was an immediate response to the treatment. That's the beauty of shockwave, you get immediate pain relief. One treatment. So, anyway, yeah, I use it for DM patients now, not just for increasing blood flow to spinal nerves, but theoretically just to help with the relaxing the tight muscles to help get the spine moving a little better at the front half of the dog where it's got more strength. And I know that Deb Taraka also is aiming it directly at the nerve roots, trying to increase blood flow there. I also think a lot of these dogs have concurrent spinal osteoarthritis, not just DM, or the facet joint arthritis. And I find it's really phenomenal for the little multifidus muscles that are spasming and the facet joints that are arthritic, helps pain with pain relief there as well. So I'll use it not so much like a laser, which I'm trying to increase nerve conduction and axonal sprouting, but more for the myofascial and the increased blood flow to the tissue around those nerves.
How often are you using your focus shockwave on your DM patients? Or are you just seeing them weekly or every other week? Or
Well, with the DM patients, we're such a multimodal treatment plan for that. Like I have one DM corgi right now, comes in twice a week. And one day he does like laser, acupuncture, therapeutic exercise. And then another day he comes in for shockwave and manual therapy and therapeutic exercise. We try to do the exercise twice a week. So we're using different modalities, but Mom felt that he had the best responses to some of the acupuncture and shockwave in terms of his front legs, but also acupuncture for the back leg for nerve function. He was more coordinated. after his acupuncture session. So we've kind of done a blend of things for him. But other people can't afford to come in twice a week, so once a week, we'll try to do like 3 treatments. We'll have a 90-minute appointment, and he might have like acupuncture, and we'll laser over that, and then shockwave, and then some exercise. So, you know, what I don't get with my acupuncture and laser, I clean up as far as myofascial pain with the shockwave.
Mhm.
So,
Yeah, I think a lot of us are doing a multimodal approach.
yeah.
I always have pulse electromagnetic field going on my patients, not
Mhm.
always, but most of the time, because I can hang an assisty loop over their neck or have them lay on a PIMF bed. And
I forgot to mention we do that too.
yeah, so
Yeah.
I've got that modality going a lot with my patients. And then I'm certified in animal chiropractic, so I'm using that as well.
Yeah,
Um,
you know, it's so funny. Like it all blends into one thing after a while. I'm certified at Chiro through Healing Oasis, but my manual therapy from rehab, I just kind of blend it all together. You know, Chiro rehab.
mhm.
I, yeah, it's
But
it's
all of that really improves your palpation skills. So you can really find where the problems are. And if you take care of the majority of if you take care of the major problem, the compensatory stuff will go away. But you need to treat it like you're talking about. But it goes away once you find the real problem.
And the other thing I find, and this is something that I try to stress to my clients, is that if you have pain or a trigger point, myofascial pain or a trigger point, your muscles can't function normally. So you can have them do exercise and build absolutely no muscle if you don't treat the myofascial pain. So you have to
Right.
get rid of the trigger point with some shockwave. And then I usually use electrical stim to activate the muscles before we start therapy, because they often the muscles are inhibited, the nerves are inhibited from the chronic pain or from the chronic trigger points, from the compensatory change. And you know, you really can't exercise a muscle that's not participating, it's not activating. Um, I've treated patients for a long time without using e-stim before I got comfortable and really started adding that into my treatment plan. And it was like night and day. So if you have an atrophy, like post TPLO, patella, FHO, all those dogs that come in with super atrophied quads and glutes,
Mhm.
I will treat the pain, treat the trigger points, get some, you know, comfort there. But then I'll also add e-stim. And so you kind of have to do the e-stim before the shockwave, because I cover my leg in gel. And you can't do e-stim if the whole leg is covered in gel. But
Right.
I've had patients that started to build muscle back post TPLO. We'd rehab them for 4 months and they weren't making progress in terms of you know, their quads were tight. They were getting patella tendonitis, this one dog, and he didn't have muscle symmetry between his 2 thighs. His thigh girth wasn't coming back. And then as soon as we started e-stim on the quads, everything changed. So I encourage you, if you're not using it, to add that on to your skill set. Happy to share with you my protocols and how I do that. And I teach clients how to do that at home. Again, like people can't afford stuff. Back pain, they can't take home a shockwave unit, but they could get an e-stim unit for $65 online. And then I help them set it up to use it as a TENS or
Right.
an NMES. So they go home and they treat their back dog for pain. They treat their cruciate post-op dog with e-stim to help rebuild muscle, stuff like that.
Cool.
No, it is cool. And people are more capable than we give them credit for. You know, I mean, we shave little windows in the fur to make it sometimes extra easy so they know where to put the pads.
Yep.
I had one client who came in with 3 colored Sharpies and she put little dots. 2 red dots were for the quads, 2 green with the bicep femoris, and the blue with the glutes. So she knew, because she was putting 2 pads, but on 2 different muscles, she was getting confused about where to put her electrode
Yeah.
pads. And that helped her. And then of course it was a great pair of knees. The hair grew back and no harm, no foul, that the dots just disappeared under the fur.
Yeah. My DM dogs, I really empower the clients. I'm a solo practitioner that's very busy. So it's a huge thing to educate clients so that they know what to do and how to take care of their pets at home so that they can continue to do daily therapy and exercises with them. 'Cause I only see them
That's why you're so busy, because you teach people how to do stuff and they're happy and they tell their friends about it. Yeah, it's definitely helpful to empower people to do what they can do at home and then figure out what they can't do. So sometimes they'll come into us twice a month just for the acupuncture shockwave, and then at home, they're doing their own treatment plan at home.
Yeah, yeah,
And you
yeah.
can really tell clients who are doing things versus who aren't based on how the animal looks when they come in. So,
Oh, yeah, absolutely. Same thing with orthotics and soft braces and even pieces of equipment.
yep.
They rent something and it comes back in and you can tell if they're using it or not.
Hmm.
Yeah.
Yep. I love when they send home videos of their animals doing home exercises at their little gym that they've created at home with brooms and things.
Mhm.
Sometimes they buy the equipment online or from us, but it's fun to watch the home videos. Yep. Yep.
Yeah.
Yeah, I love my Paizo Wave. That's why we have two. Um, and yeah, I'm trying to think how else. I love using it on cats. I don't know if you've used it yet on any cat patients.
I
Um,
haven't. I've got two cats at home that may be unwilling participants, but I can try it on them.
well, I've had a lot of success with cats that have chronic LS pain,
Yeah.
and also cats that have had cruciate or patella injuries and or surgeries that went sideways, and they're really contracted and tight. But it helps a lot for the the disc pain and the arthritis and myofascial pain. And sometimes they only need one or two treatments, and they can really improve. I had one cat that after one treatment, he was able to go up and down stairs again. He was a young cat that had bilateral FHOs because he had ischemic necrosis of both femoral heads, and they didn't really know that when they adopted him that he had arthritis going on from this femoral head disorder. And until he jumped wrong and broke one, and then he jumped down and broke the other, and they had to have FHOs on both sides. And this cat hadn't been meowing, hadn't been playing, and he had one Paizo wave and acupuncture treatment. And he went home and he was like meowing and playing and going up and down the stairs. They were like crying, they were so happy. Their testimonial was wonderful about how they got their cat back, and they didn't know he even had a voice. He didn't used to meow, and now he talks all the time. But one of the things that I do, if I use a lot of gel, I try to, get through the fur to make sure I'm getting a good treatment in. I'll take a hot towel afterwards, because we usually rinse off our dogs before they go on the treadmill or the pool, because we use so much of the gel to get through the fur to really do a good treatment. We have a little propane gas shower here. But for the cats, I'll heat up a hot wet towel, put it over them, and then I'll take a comb and I'll just comb through some of the gel, like a flea comb, to get some of the gel out of their fur. And it's also a good fascia treatment. The heat, the moist heat, and then the flea comb. And so it's like their spa treatment. And some of the cats just love it, and others won't hold still for it. But if they'll hide under a towel, you can put a towel over them, put the hot towel over the gooey parts and comb it. And then sometimes they'll let me do a little hip extension or hanging traction if they're like an FHO and their leg is hiked up and they don't want to extend their hip. They're a lot more comfortable after the shockwave. So I encourage you to try it with some cats. One of the things that make it possible for the more active cats is a little bit of Buprenex orally beforehand. And if I had one that really needs some treatment, I'll have them hi there, Heather. I'll have them mix a little bit of injectable ACE, like into the oral Buprenex, and that really smooths them out, but they're not totally knocked out, and the owners can give that an hour before they come in. The Buprenex dose with like 5 units of ACE, or even 2 units, insulin syringe units of ACE added, makes them really relaxed. And gabapentin doesn't hurt either. But yeah, and yeah, I have some cats who just love it. They just love the treatment. We weren't making as much progress just with acupuncture. I find sometimes they're so painful when I'll place needles in those tight muscles. It helps to relax them, but they hate it. And so if I can do the shockwave once or twice and then acupuncture, they tolerate it a lot better, especially if they need the acupuncture for other neurological reasons.
Yeah. Have you tried using it on pressure points and just using it like you would a laser and just going point to point?
You know, I use it along the spine on almost every patient. So I'm really treating acupoints all the time. I'm not specifically focusing and holding it at a point. I'm fanning through those areas. So I'm on the bladder meridian. Um, I'm treating around the hip. So I'm getting all of those acupoints that for hip dysplasia. Um, I'm treating where, a lot of really juicy acupoints are right where the trigger points are, myofascial trigger points, right? So the Chinese figured that out 6,000 years ago. If you have a knot, you stick a needle in it, it breaks up. It feels better, and you can use your arm again. So I treat a lot of those points with shockwave because I'm treating trigger points. I don't do dry needling. Um, Unless I've got like a walnut size knot that I cannot get to break up with even with the shockwave.
Okay.
Sometimes maybe one patient I've done that, and I'll do it after a shockwave so that they're not so sensitive. But I tend to shy away from dry needling. I know a lot of like Rick Walls and Matt Brunke and people like to do the dry needling. I use shockwave as a non-painful dry needling technique. Absolutely, my preferred way of treating a trigger point. On myself as well. So, and when I get acupuncture, I know it helps to break up knots. Um, for animals that don't want to be handled a lot, then I'll place needles, right, and I'll back off. But if they'll let me do the acupuncture and the shockwave, I get a better outcome for sure, for sure. What else can I share with you all about that? I would say. I have some patients that I shockwave first and then acupuncture after, and I know they're wet and it's not ideal, but I do it. Um, I haven't had any problems with it. You can't laser after you've shockwaved. You've got wet gel all over the dog. It's going to absorb your laser. So you have to keep that in mind if you're doing a DM patient and you want to treat with laser to stimulate nerve conduction, but then you want to treat with shockwave to help with myofascial pain because the laser isn't getting enough relief for them. Then I shockwave after the laser, and I'll do both at the same visit.
Yeah, I do too. I know there are some people that say don't do them. One's anti-inflammatory and one's kind of pro-inflammatory, but I don't think it's an issue.
I think both are increasing nitric oxide in tissue, helping relieve pain. Yeah, that's a good point. But I don't know. I've found that I think about laser as imparting more energy to the cells to do what they do faster and to encourage nerve growth. And I think of shockwave then as more relaxing tight tissue to improve pain and increase blood flow. When you relax tight muscles in your spine, you get more blood flow into the nerves. That's just a fact. So um, you can see it ultrasonographically on muscles treated before and after shockwave, how dense the tissue is versus more blood flow in the tissue afterwards. It's fascinating. Um, the other thought I just had, another unusual way that I use my shockwave is for those vestibular cases where you have your atlas subluxation. I don't know, Heather, if you're certified in Cairo, but you probably palpate a lot of atlas occiput malalignments, and most of my vestibular cases have an atlas occiput malalignment, and the muscles are super tight. So I'll use the shockwave, a 5 millimeter pad, to get to relax those tight muscles before I do joint mobilizations or an adjustment, and it makes a huge difference on getting that atlas occiput moving again. Because sometimes that's so chronic in some of these dogs, just mobilizations and an adjustment just doesn't cut the mustard. And I'll put acupuncture needles also, GB20, that's right into some of those tight muscles. But I'll also sometimes shockwave. And what I learned the hard way, because I'm a vet and I think more is better, but often less is better. I acupunctured this cat that had really bad atlas occiput. I did GB20 and it was definitely better. I did some joint mobs and then I was treating his myofascial pain with shockwave for his back end. And I thought, well, let me just do a little bit of shockwave to the atlas occiput region. I had a a 5 millimeter probe, and I had it at like 0.2 or 3, but the actual tapping caused him to have a little mini seizure. So it was too much stimulation. Have you had that happen?
Well, I've had a tremor, and it looked like almost a preictal start of a seizure. Yeah, kind of a little focal one happened from that. I was actually just kind of started with a tuning fork, and then kind of went into a little bit more, and I started to notice it. Thought, oh, better back off on that vibration.
Right. Yeah, it was too much. And the cat had a grand mal seizure that lasted about 15 to 20 seconds, woke up from it, went right back to eating fish flakes that he was eating before. And then he went home and he was so much better. And his oxypod and his Atlas were liberated. I was like, okay, I'm not going to do that again. But because it scared the hell out of me, I emailed the owner at least 3 times that day. How's he doing? How's he doing? And she's like, wrote back the next day, he's fine. In fact, he's even better than ever. So like, well, that wasn't the goal. It was too much sensory input to the central nervous system. But boy, does it work. So yeah, tuning fork is a good way to start. I don't know, Paul, if you've used a tuning fork for vibration, it's really cool and much more gentle vibration than any of the massagers, the paw wave and the shockwave treatment. Paw wave is another thing we send people home with, the vibration massagers. They're really good for bigger dogs, especially, and for dogs with DM with the front legs that are tight. Paw wave, PAW wave, and the CNAPs are even doing like some studies with it, demonstrating the frequencies and the vibration. It's like being on a vibration plate, but it's a wand that they can move along the body. And I'm using that for muscles that are tight in the shoulders and neck. And then I'm using it on weak hamstrings in the butt and the back paws for dogs with sciatic nerve insufficiency and weakness, to try to facilitate and activate those muscles before they go on a walk. For people who can't do the e-stim at home or not coordinated enough, or the dogs don't sit still, or for whatever reason they aren't doing it because it takes too long, they can grab the paw wave and then put it on the dog's flabby hamstrings and gastrocs and on the backs of their paws, on the bottoms of their feet, and wake up those nerves and get better input when they go out for their walk.
Interesting.
Yeah, I contacted the paw wave people because they have one for cats. It's a flatter wand that's not as intense, and I was going to order some to have here because we're recommending it to so many people. I figured we might as well carry them because they want to take them home that day when we demonstrate it. And so they have to go online to buy it right now. They never really got back to me. But so we'll do shockwave here, and then that's a tool they can use in between sessions. So if they're going every 2 weeks because they can't afford weekly therapy forever, or some people's pet insurances they probably hate me, but they're paying for it, Trupanion and Healthy Paws and all that. They could do paw wave in between. I send them with the loop, obviously the sissy loop, or a PEMF bed, respond bed, or a sissy bed. Those things they can do in between. I love rehab. Can I just say, it's the best. I love combining all of this cool stuff and, all these modalities and manual therapies, chiropractic, acupuncture. We're so lucky.
Can I ask you just a case kind of question on
Sure.
the piezo wave?
Sure.
What would your thoughts be on an immune-mediated polyarthritis? It was diagnosed about 3 years ago, primarily in the carpal joints, bilateral elbow, and also stifles, though it was also post-TPLO by two years at that point. It was a pretty thorough workup, so definitely a confident diagnosis. Patient's been on, I'm going to botch it's lufenamide, I think they went through the pred and the azathioprine and the mycophenolate and have been on this one now for a couple of years. Seems pretty stable, but we just saw this dog yesterday and it is so stoved up. His joint range of motion is maybe 15-20% of what it should be. Both elbows, both stifles. The wrists are actually really good. I'm really surprised at what happened there. But I mean, what's our risk benefit at this point? Because it seems like that'd be the best modality to get that broken up a little bit more. I can barely traction. I mean, I can do range of motion. I could probably, I guess, do some needlework around there, maybe some EA safely, I would imagine. But I'm just a little hesitant with the shockwave and the the
You can
polyarthritis.
absolutely use it. Absolutely use it. Yep. I have a little, oh, she's gone. I had a little corgi here with immune-mediated polyarthritis, and she's walking plantigrade and palmigrade, carpal collapse 100%, tarsal collapse, um, bilateral stifle cruciate, from all the joint ligament, the flexor tendon laxity and instability that the prednisone, but also the disease created. And I use my shockwave for any joint contracture. I use it for any for increasing range of motion. I'll use it on all the muscles around those joints because those are really tight. And then I'll use it at a lower intensity around the joint capsules of all of these joints to loosen up some of that scar tissue. If there's a fusion, if you can feel a fusion still in the joints, I do treat very low intensity, but I also get all of those dogs on Adequan, like ASAP, if she's not already on it.
Good. Yeah.
And I use
Okay.
it twice weekly, like for longer periods than most people do, because they respond so beautifully to it. There was a lovely treatment that's no longer available called T-site. It was a T lymphocyte immunomodulator to get the T sites to stop attacking the joint material. And it was really helpful, but it still was a provisional FDA approval, and the researcher hasn't published his data, and so the FDA is not willing to extend his provisional, but that worked really well too. But yeah, and then whenever you have joint contracture, like tendon capsular fibrosis and all of that, Piezo is great for helping to get some range of motion back in there. They can be painful when you treat, so I go very low intensity on those, like 0.3, 0.4, 0.5. I start maybe even at 0.1 to 2 and I turn it up. Just know that you're affecting tissue change and then do your manual therapy afterwards. I do the same thing for animals that have been like casted for an injury and they've been casted post-op for like a radius fracture, and now their carpus has no range of motion and their digits have no range of motion because they've been in a cast for like 8 weeks with no range of motion in between, because the surgeon said don't do anything for 8 weeks and then they send them for rehab. It's like, if only we could have had you in an orthotic, but some clamshell removed and just some range of motion, just some shockwave in between, we wouldn't have gotten to that contracture. But yeah, any kind of contracture. And I'm not worried about triggering the immune system. I have never seen a dog. Yeah, I've never had a flare for immune-mediated patients.
Perfect. Well, thank you guys for all your time. Sorry I could only chime in at the end here, but I was listening.
Oh, good. That's fun. It's always fun to hear how other people are doing things too. The tuning fork is a great idea for that cat. Maybe I'll try that next time. Or maybe I'll just, I told her we're no longer doing acupuncture and shockwave on the same visits. We're doing them alternating. Yeah. I mean, he's an old geezer of a cat, but he's such a tough cookie. So.
Well, Dr. Strubel, thank you. It was really fun listening to all the different ways that you use shockwave in your therapy business and incorporate it with other modalities. So thank you for your time. Paul, thanks for joining us. And we'll catch you guys hopefully next month.
Yeah, I hope to. It's hard. I'm in the middle of appointments right now, like Heather, but yeah, I'll try to join in when I can.